Vitamin B7 is more commonly known as biotin. It's a B vitamin. Like all B vitamins, biotin aids the body in breaking down carbohydrates, fats, and protein for energy production. It also has a role in maintaining healthy skin, hair, and nervous system function. B7 is a water-soluble B-complex vitamin essential for the growth and the development of all organisms. As a coenzyme of carboxylase enzymes, B7 is involved in the metabolism of fatty acids, amino acids, and carbohydrates. Biotin has been shown to be important for many health factors, including supporting neurological function, steadying blood sugar levels, DNA stability, and hair, skin, and nail health. The body can't synthesize B7, so it needs it to be obtained regularly from the diet and from intestinal bacteria. Biotin can be found in a wide variety of foods, including animal liver, egg yolks, cow's milk, and some fruit and vegetables. Although B7 deficiency is rare, it can be dangerous if it's left untreated. Suboptimal levels or marginal deficiencies, which are a lot more common, have been linked to a variety of negative health effects, including growth retardation, neurological dysfunction, hair loss, skin rash, muscle pain, and anemia. Groups at risk for a biotin deficiency include smokers, alcoholics, pregnant women, and people with inflammatory bowel disease. Oral B7 supplements are completely absorbed even at high pharmacological doses. Biotin is absorbed via a sodium-dependent multivitamin transporter in the small and the large intestine. After transport from the intestine into the systemic circulation, biotin is taken up by the liver and eventually crosses the blood-brain barrier into the central nervous system. Soon after oral ingestion by humans, single high-dose biotin is eliminated from the circulation, leading to a significant increase of urinary excretion. Therefore, for prolonged maintenance of blood biotin levels, lower doses, 300 micrograms each day for 1 week, are recommended. Roughly half of the absorbed B7 undergoes metabolism to other forms. The elimination half-life time of biotin is approximately 1 hour and 50 minutes. Biotin is a coenzyme for carboxylase, the enzymes that assist in the metabolism of fat, protein, and carbohydrates for energy production. These enzymes are essential for the following processes. For gluconeogenesis, which is the metabolic pathway that produces glucose from non-carbohydrate sources, including amino acids. For cellular energy production, the use of branched-chain amino acids like leucine, isoleucine, and valine for neurotransmitter production and for energy. The synthesis and the breakdown of fatty acids and insulin release. So inadequate B7 in the body can slow down metabolism, and this can lead to fatigue, digestive problems, and weight gain. Biotin is required for myelin sheath formation. This is a fatty substance that surrounds nerves and it facilitates nerve impulse conduction. As such, biotin deficiency can delay myelination. Biotin deficiency can also lead to a number of other neurological symptoms, including seizures, lack of muscle coordination, learning disabilities, hallucinations, depression, and lethargy. Most of these conditions can be resolved with biotin supplementation. High-dose biotin supplements, 5 to 10 milligrams per kg per day, was also effective in treating biotin-responsive basal ganglia disease, a rare brain metabolic condition characterized by seizures, confusions, and abnormal coordination, in a review of 18 cases. Multiple sclerosis is an autoimmune disorder characterized by myelin damage and loss. Given its role in fatty acid synthesis and energy production, both which are needed for myelin repair and axonal survival, it's been proposed that biotin may be effective in limiting or reversing multiple sclerosis-related impairments. In fact, 2 clinical trials on 177 people found high doses of vitamin B7 was able to reverse disease progression and improve symptoms in patients with progressive multiple sclerosis. However, the treatment had little or no effect at improving visual acuity in another trial on 93 people with multiple sclerosis. B7 is needed for white blood cell development, and a deficiency is linked to impaired immune function and an increased risk of infection. It increases the production of Th1 cytokines like interleukin-1 beta and IFN gamma, which are essential for eliciting an immune response to fighting bacteria and viral infections. Inadequate levels of B7 are associated with decreased antibody synthesis, T cell decay, and lower amounts of spleen cells and T cells in both animals and humans. Decreased rates of cellular proliferation during biotin deficiency can account for some of the adverse effects on the immune function. A deficiency of biotinidase, an enzyme that helps to recycle biotin, is associated with chronic vaginal candidiasis, and is treatable with biotin supplementation. Since 1 in every 123 people is believed to be deficient in this, women with chronic vaginal candidiasis may be responsive to biotin supplementation. Biotin may help to lower blood sugar levels by increasing insulin production, enhancing glucose uptake in muscle cells, and stimulating glucokinase, an enzyme in the liver that promotes glycogen synthesis. Daily supplementation with B7 decreased fasting blood sugar concentrations by an average of approximately 45% in a clinical trial on 43 people with type 2 diabetes. This vitamin increases the activity of 3 enzymes involved in glucose breakdown: pyruvate carboxylase, acetyl-CoA carboxylase, and propionyl-CoA carboxylase. This was shown in a clinical trial on 30 people. When it's combined with chromium picolinate, it improved blood sugar management in 2 clinical trials on almost 500 uncontrolled diabetics. And furthermore, high doses improve the symptoms of a nerve damage condition commonly exhibited in diabetic patients, known as diabetic neuropathy. All in all, the evidence suggests supplementation with biotin, especially in combination with chromium picolinate, may help to control blood sugar levels and reduce the risk of diabetic neuropathy. You can use biotin as a complementary approach to managing your blood sugar levels. Biotin is required for normal fat metabolism, which is critical for maintaining heart and blood vessel health. In combination with chromium picolinate, B7 helps to reduce heart disease risk factors by increasing high-density lipoprotein, or good cholesterol, and decreasing low-density lipoprotein, or bad cholesterol, especially in 2 clinical trials on almost 400 diabetic patients with heart disease. Pharmacological doses of biotin are 15,000 micrograms per day, and these were effective in lowering blood triglyceride concentrations in 33 patients with elevated triglyceride levels. Although limited, the evidence suggests biotin can help to reduce the risk of heart disease. A biotin deficiency is linked to a number of skin conditions, including seborrheic dermatitis and eczema. This may be related to biotin's role in fatty acid synthesis and metabolism, which is critical for skin health. Skin cells are particularly dependent on fat production, since they require extra protection against damage and water loss from constant outdoor exposure. Inadequate levels of B7 can also lead to hair loss, which is reversible with supplementation. Although some studies have found B7 promotes hair growth in women with thinning hair, there's minimal evidence to support that it promotes hair growth in otherwise healthy individuals. Biotin may enhance the quality of brittle nails, with affected patients exhibiting firmer, harder, and thicker nails after treatment. Marginal biotin deficiency is common during pregnancy due to increased biotin demands from a growing fetus. In animals, even with subclinical levels of biotin deficiency, it can result in cleft palate and limb abnormalities. It's hypothesized that a low biotin status during pregnancy can increase the risk of birth defects in humans by altering fat metabolism and increasing genomic instability, both of which can lead to the development of chromosomal abnormalities and fetal malformations. In human embryonic palatal, the roof of mouth stem cells, B7 depletion was found to suppress carboxylase production and cellular proliferation, indicating lower levels of B7 may delay or halt the growth of the embryonic palate, resulting in cleft palate development. Biotin covalently binds to histones, DNA binding proteins that help to fold and package DNA into chromatin. The addition of biotin to histones plays a significant role in cellular proliferation, gene silencing, and DNA repair and stability. Low levels of biotin can lead to inadequate histone biothinylation, and this can result in genomic instability and abnormal gene expression or cellular production, and this increases the risk of cancer. These effects have been shown to increase cancer risk in fruit flies and in cell-based studies. However, higher levels of biotin, up to 600 micrograms, were actually found to increase genomic instability and damage in one study in humans. This suggests biotin's DNA stabilizing effect may be dose-dependent. In any case, the causal link between histone biothinylation and DNA damage risk in humans remains to be further investigated. Research from mouse models and human white blood cells indicate biotin deficiency can increase the production of pro-inflammatory cytokines and aggravate inflammatory conditions. In biotin-deficient mice with nickel allergies, biotin supplementation decreased the production of pro-inflammatory cytokines, and it improved the allergic inflammation, suggesting a potential therapeutic effect of biotin against inflammatory and allergic diseases in humans. This may be the result of a decreased NF-kappa B activity, which is activated during a B7 deficiency. The BTD gene encodes biotinidase, an enzyme that recycles biotin. Biotinidase transports free biotin through the bloodstream and attaches biotin to other proteins. Single nucleotide polymorphisms in the BTD genome are associated with an increased incidence of psoriasis, and the C allele is associated with a higher incidence of coronary heart disease. The SLC5A6 gene encodes the sodium-dependent multivitamin transporter that helps to transport biotin into the cells. This gene encodes hollow carboxylase synthase, an enzyme that attaches biotin molecules to histones and carboxylase enzymes. Mutations in this gene can reduce biotin binding to molecules, and it can suppress carboxylase activity, resulting in impaired protein, fat, and carbohydrate metabolism. They can also affect the production of genes that are important for normal development. Biotin is generally considered safe, and no toxicity has been reported for doses up to 300 mg per day orally, or 20 mg intravenously. Since it's water-soluble, a B7 overdose is unlikely, as excessive amounts are excreted in the urine. High-dose B7 supplementation can skew a thyroid test result and mimic the lab patterns of Graves' disease. Lipoic acid competes with B7 for binding to the sodium-dependent multivitamin transporter in the intestine, so long-term use of lipoic acid could result in depleted B7 levels. Similarly, large doses of B5 or pantothenic acid have the potential to compete with B7 for absorption. Prolonged use of antibiotics like tetracycline can reduce biotin levels because they kill biotin-producing bacteria in the intestines. Some anticonvulsants can inhibit B7 absorption. Chronic anticonvulsant use can also increase B7 breakdown. Raw eggs contain the protein avidin, and this binds biotin tightly and it inhibits its absorption. Smoking accelerates biotin breakdown, especially in women, and this can result in marginal biotin deficiency. Chronic alcohol consumption can inhibit intestinal biotin absorption. There's no recommended dietary allowance established for B7 because of limited data on the bioavailability. Adequate intake for B7, established by the Food and Nutritional Board, Institute of Medicine, suggests for adults aged 18 and older, 30 micrograms per day. For pregnant women, 30 micrograms per day, and breastfeeding women, 35 micrograms per day. For more information about herbs, supplements, and natural treatment plans, check out my website.